Hello and welcome to Public Conscience, the anti-corruption program produced by the Progressive Impact Organization for Community Development, PRIMORG. I am Chidozie Ogbonnaya with Esther Bassi.
Thanks for joining us. The spelling of PRIMORG is PRIMORG.
On Public Conscience, we seek to evolve a corruption-free society by drawing government and citizens' attention to corruption reports and issues for prompt democratic actions against them. We also promote the integrity by amplifying rare cases of the display of honesty by public and private individuals. We appreciate the MacArthur Foundation for supporting the production of this program.
In the last 3 years, we have been raising the alarm and calling on relevant government officials to confront the illegal sales of free mosquito treated nets on the streets of Nigeria, following different investigative reports at our disposal. It is, however, unfortunate that the situation remains the same, going to a more recent investigation done by Clearview TV with support from the Wole Soyinka Center for Investigative Journalism. This is our focus on today's program.
According to the report, efforts of the government and its partners to combat malaria in the country continue to be undermined by corrupt officials as households who are to receive these nets free of charge through primary health centers and other distribution channels do not get them. This investigation alleged that officials, through proxies, were corrupting the distribution process and commercializing it for personal gain. This happens by them holding and selling them to retailers, while pregnant women and children suffer the scourge of malaria.
Well, malaria is a major public health concern in Nigeria, with an estimated 68 million cases and 194,000 deaths due to the disease in 2021. Nigeria has the highest burden of malaria globally, accounting for nearly 27% according to the 2022 World Health Organization report.
Today's program will once again draw the attention of the Federal Ministry of Health and its agencies to the alleged diversion of free mosquito nets, treated nets by officials for personal gain. For you out there, we will want to find out if you have been buying mosquito nets branded not for sale and at what cost. Why do you think this corrupt act has been sustained in Nigeria over the years? How best can the government and its agencies combat this hydra-headed monster? Are you aware that mosquito nets with the inscription not for sale hawked in the streets of Nigeria are not supposed to be sold?
Well, be ready to join us through phone and text messages during this conversation. The WhatsApp phone line to send your message is 0902-265-6167. That is 0902-265-6167. Please indicate your name and your location when sending your message. This number is for messages only.
Please begin to send your messages as soon as possible to 090-2265-6167. That is 090-2265-6167. We will give out the numbers to call shortly.
And if you just joined us, the focus is on investigative reports alleging that public officials are still colluding with traders to sell free donor-funded mosquito nets to Nigerians, thereby hampering efforts to eradicate the malaria scourge. This investigation was done by Clearview TV with support from the Wole Soyinka Center for Investigative Journalism.
We invited the Minister of Health and the coordinator of the National Malaria Elimination Program to join us, and I can tell you that we have a representative from National Malaria Elimination Program in the person of Dr. Aminu Mahmood joining us this morning. Thank you for joining us.
Thank you, everyone.
Also in the studio, to discuss this allegation of diversion of not for sale mosquito nets by officials and its implications, also, and how government can confront the bare-faced health corruption. We have Nten Eban, script editor, Trust TV, joining us.
Thank you very much.
And also Dr. Victor Tubo, medical practitioner and leadership consultant, joining us this morning. Thank you so much for joining us.
Thank you so much for having me.
All right. So let's start this conversation with Nten, because before now you were with Clearview TV, and you were part of the team that went out to do this investigation.
Yeah.
So help us understand what you saw on ground, what was going on.
Okay, I actually carried out the investigation here. I led the team. Prior to joining Trust TV, I was engaged with Clearview TV on the program that has been sponsored by the Wade Center for Investigative Journalism, the C Media Project. That's a collaborative media project. And part of the project is to carry out investigative reports. So I had to buy a mosquito net one of those days, and I saw it was branded not for sale. If it is not for sale, why are they selling it? I was staying at Massacre then, that's somewhere in Nasarawa State. And we took that information to the office and let's discuss how true is this? Where is it coming from? And we got to know that the mosquitoes are from the National Malaria Elimination Program, branded not for sale, but they are being sold. And in 2019, my daughter of about 1 year had cerebral malaria and almost died. So I had a personal relationship with this. I had a personal attachment to this subject matter. So that was how we got to, okay, now let's do this investigation. So, yeah, we set out to, since our location for the report was Nasarawa State, so we chose Massacre and Maraba. Those are the two popular areas there. So we went to Maraba, and if you go in between the two lanes of the highway, that's the Abuja Kefi Highway. In the middle of it, you see them like 1, 2, 3, over 10 lined up selling those nets. So we didn't just want to make a blanket allegation. So we said, fine, let's go and find out. We had to pay our crew members. When we got there, set the cameras, everything, we gave him money, go and buy. So he went there, bought the first place, came, we stood there. So it's not like we carried it to the house to go and open it. We stood there, the video is there, the online link to the report is there. We stood there at Maraba, opened it, clearly labeled, not for sale, distributed by National Malaria Elimination Program. We said, okay, let's leave that. Let's buy another one and check again. So we left that side, came to this other side, bought another one from, I think that was from USAID or US President's Initiative for, and it's clearly written, not for retail sale, right? And we just bought it at retail sale. We left that place and still went to Massacre, another access in Nasarawa State, under Karu. We went there again and we still saw them being sold. So we bought like 4 nets to establish the fact that yes, these things are being sold, even when they are branded not for sale. So we went forward to ask, how do you guys get these things? But we now found out they were under instruction not to mention. What do you want to do? And I said, okay, we posed that if we wanted to buy a lot of them, like 100 or 1,000, to go and share in constituencies. They said, okay, we'll give you, when you are ready, we'll tell you there's a warehouse somewhere that the people give us the access to the people. They said no. So they were under instructions not to. And if they are mosquito nets from federal government, where will they come from? Your answer is as good as mine.
So something is happening, something wrong is going on with
absolutely
distribution channel.
In fact, one of the women in the whatever I said, she had gone to one of the distribution centers. They kept them from one day, from morning till night. They didn't give them the nets, but some people came and took them in bags and went and started selling, while the women were queuing for the entire day. These are all documented. In fact, we went to a health center. The health center people confirmed. In fact, the nurse in charge of that health center in Louvo said they have not been given nets. That even women in the village, they come to insult them. They don't know that they don't have the nets. And that she has also seen that those ones that are labeled not for sale are still being sold. She acknowledged that much.
All right. A good place for us to have the Assistant Director, National Malaria Elimination Program, Dr. Aminu Mahmood, come into this conversation. Dr. Aminu, thank you for being here.
Thank you so much for having me.
We appreciate coming to clarify some of these things. A whole lot of things is now looking like something the citizens are used to. Let's have your reaction to this investigation and the rot in the distribution channel, the sale of not for sale mosquito nets on our streets. What's your reaction, and is your agency very much aware of this?
So I would like to start with thanking this radio for hosting us and for arranging for this. I think it's very important for people to know that mosquito is a very dangerous, something that we in this country, we don't like it because it claims hundreds of lives of so many people. And mostly those people are children below the age of 5 and pregnant women. And unfortunately, those are a group of people that doesn't talk. And because they don't talk, people doesn't even know how much life that this malaria is causing. Based on our estimates, in 2021, about 68 million people were infected with this malaria, and about 194,000 people died from malaria. If you just put that figure, 194,000 deaths is a very huge number in 1 year. If you compare, I'm sorry to compare it with some scenario happening currently, like all this insurgency and insecurity. If you take that number, it's a very huge number. But because it is affecting children that doesn't talk, people doesn't even know that this is happening. So I think it's something that we, as a country, we should do everything that we can to prevent that. In 2020 to 2021, during COVID, at the same time when there's lockdown because of COVID, malaria killed more people than COVID. But because of COVID, the whole country was shut down. But because of malaria, the country is still running. Nobody is locking down anything. So I think we need to understand that this malaria is very dangerous and we should fight it with everything that we can. So regarding this report, this needs from our program, we have been distributing this needs. We started this distribution in 2009 when we developed our new strategic plan. And
2019, you mean?
2009.
2009.
Yes, that is when we started this distribution. So from that time to 2021, we have distributed over 220 million needs across the 37 states of this country. And these needs were being distributed free because we believe that these needs are the main thing that can protect our people. Most of our people doesn't have the resources to buy the drugs to treat themselves for malaria. And it's not just about the drugs. You have to do testing because that is our recommendation. You cannot just have just go to over the counter and buy anti-malarial drugs. Our recommendation is do tests before you treat yourself. So as much as possible, you have to also do testing. So it costs a lot of money for people to keep themselves healthy. And we know that these are mostly children and pregnant women, and they are vulnerable population that doesn't have that capacity to buy those drugs and to do the testing. So this nets serve as a barrier between ourselves and a mosquito. We know that the malaria is normally caused by female anopheles mosquitoes. They are the ones that normally come into the household and bite people.
Dr. Mohammed,
yeah.
Let's get to the distribution
okay.
channel. You talked about giving out 220 million.
Yes.
How did you monitor to be sure that this net gets to those who truly need it? It's one thing to say we distributed, and another thing to make sure that it gets to those who are actually in need of it.
So this net, over the years, we have developed so many mechanisms to ensure that they get to those that need it.
Let's get to hear them.
So, firstly, we normally work with our partners who normally provide us with most of these needs. And then we work with the state government. In the state government, we work with they have their own malaria programs,
okay.
and the state Ministry of Health. They are the ones that normally handle the last mile distribution of this net. So our own is to work with our partners to get the net into the country. Then when the net came into the country, work with the state to get the net to the state. Then when the net gets to the state, we work with the state government for those nets to get to the last mile. That means to the local governments. And then at the local government, we work with the people in the local government. We have some malaria personnel that are working in the local government. And then from there, the net will be taken to various wards and the communities that those nets have been distributed.
Sorry to jump in there, because I know that this investigation by Clearview TV is almost looking like a deja vu, because it's not today, it's been reoccurring.
Yeah.
When some of these investigations hit the news and get to your office, I believe that you people get to hear it.
Yes.
How do you react to it? We are
actually
talking about there's a loose end.
Yeah. In our program, we are really, really saddened to hear this kind of news, and we are very glad to even hear it, because someone that wants you to improve is the one that will tell you the truth. If you see something bad happening, until when these kind of things are becoming out, so that everybody will know what is going on, people are becoming conscious that we are having this kind of things in this country. That is when we can have people to take action. As you know, we are a regulatory agency that's involved in this prevention and control of malaria. So our own part of work is to ensure that people are being protected, people got the necessary treatment for malaria. So, but we know that a lot of times when this net has been distributed, in the process of that distribution, there is some filtering of this net. Some people, I don't want to call them with any name, are involved in that kind of unholy behavior, which is uncalled for. It is really, we don't want that. And as much as possible, we engage people that we believe work within the community. So the people that are involved in doing that are people within those communities that we are distributing those nets. As you know, we as a program, we have only few people that are working within the program, and we cannot be involved in the distribution of. Imagine 220.
So you are saying the compromise is not from the National Malaria Elimination Program end, that so it is maybe your subsidiaries, people you.
So let me complete my statement. So besides those incidences, we know the situation of the country. Sometimes, besides those middlemen, we also had instances where some head of household sold the net that was given to them because of poverty. We know that this is something that is happening in the country. When people are poor and they got something as precious as meat, and maybe they have stayed for like 24 hours without anything to eat. So the only thing that they can do is to sell those nets. So the same middlemen that give them those nets, they also have resources to buy those nets from those people. We have had that news. And we should remember too that this nets, we also go to open market to buy them. And those companies that we are buying those nets from, also they have the right to bring those nets into this country. So also, they too sometimes bring those nets to sell.
With branded not for sale.
That is what is concerning, to be honest. And it's something that we as a program, we really want to understand more on what is happening around that.
We'll get back to you so that you tell us how you are going to fight this, or what you're doing to stop this malfeasance.
All right, let's bring in Dr. Victor into the conversation. Dr. Victor, how would you react to this report, and how important are mosquito nets in the global efforts to eliminate malaria?
Okay, like we've discussed, malaria is among the leading causes of infant mortality, and under 5 deaths worldwide, but more particularly in Nigeria. So the prevention can never be overemphasized. It's something that is very important. And considering the endemic nature of the disease here, people currently just have fever, they have chills, they just go over the counter to buy medications. And this abuse has consistently resulted to what you call resistance to certain strains of treatments that used to be the common thing previously. Now we are on ACTs, artemisinin combination therapies, and the more people abuse these drugs, the more complex treating this disease continue to evolve. So the negative impact continue to affect us both medically, socially, economically. Even when you look at the disease in itself, I don't know if you are aware, but sickle cell is a black man's disease. The Caucasians don't have sickle cell. It's only you, I, and maybe some people in the Middle East or somewhere like that where the female Anopheles mosquito thrives in our temperate weather, that you see sickle genes, and that was an effort in the human body to protect itself from malaria. Now, the normal life cycle of the normal red blood cell is around 120 days. And when these plasmodium parasites get into the bloodstream, the cells they attack the most are the red blood cells. So what the body tried to do was to lose certain components at genetic levels to develop what you call the sickled gene. And the life cycle is around 10 days or thereabouts. And what it tries to do is to die before, let's say, completely eradicate that environment that supports the plasmodium to thrive and to grow. So on individual level, it protected us. But eventually, when people now begin to intermarry who have developed this sickle gene and have it as a trait, mean AS, and then they marry another person, you now see that there's an SS possibility, which if you've seen anybody who has that, you know it's very, very, very terrible. So I'm just trying to buttress on how widespread this thing affects us.
How it can stretch and touch other.
It touches everything from our pharmaceuticals. It makes it more expensive. The research is more expensive. Our body is even modifying in a way to accommodate or to protect us, and it now gives a negative feedback that now is like shooting ourselves on the leg, because eventually it protected you, but now the next generation has sickle cell as maybe inherited from both parents and all of that. You come on the other aspect socially, all right, and the cost of livelihood. It's just so much. So if I want to talk about react on the report, I think it's not a complex topic. There is something evident that shows that what is being sold on the street is labeled not for sale. Some of them with the USAID label, some of them with our own local government agency labels. So first of all, it tells us where it's coming from. Number two, there is a report on warehouses. All right. While I know what doctors said is true, of people who were given this thing free of charge may go out ahead to sell it for 2,000 or thereabout, but that cannot
the quantity that is out
cannot produce the quantity that will have to stock up in an entire warehouse.
Yeah.
So it gives us a very, very clear evidence that there is a compromise in the distribution chain.
Okay.
And it's still not rocket science, because we have courier services that distribute things all over the world. And with the use of technology, you could track the distribution of things. And this is what I think our regulatory agencies should begin to engage. Technology has made a lot of things very easy in the day and time that we are in. So this, what do you call it, malaria stuff, they have serial numbers, they have, they're tagged, the nets, yes, they're tagged, they have serial numbers. So we could go back and do the hard work of redeveloping our distribution system and putting some technology in it, and somehow it's even something that is everywhere right now. I have, at this very moment, that I'll call on 10 persons who can develop this in maybe 2 weeks, and the agencies could begin to use it. So this way, we're able to track how things are moving. And the moment, what we're trying to do is, if it moves from doctor's hands as the first point of distribution and gets to my hand, all the numbers, the serial number batches, maybe S2102 to S2577, were the batch that got to my own angle or my own level in the distribution chain. Automatically, the name, that batch is tagged to my name.
Right.
So we can track that it moved from him to me. Okay. And then from me is going to the next person. That same batch is, of course, maybe it moved from him to me, and maybe he distributed to 5 persons. Then from my angle, I'm at the state level, I'm supposed to distribute to local government. Maybe I'm distributing this S2152 to S2577. I'm now distributing it in other smaller batches to maybe 10 persons under me. We can also track who it got to.
So it is not rocket science.
It's not rocket science.
It's not something that
any
we
individual could literally take his phone from the admin angle and check where is the the nets at this time? How many is installed at the primary health centers that has not been distributed? So we can monitor what is coming in, what is moving, what we have in stock. Because on the other angle, when these things are not monitored, you could even spend so much in bringing, like I know government doesn't get this for free, right? It gets to people free, but through partnership, there in some ways that it costs government also.
Doctor, I'm going to come back to you, but I want to bring in our audience, our listener out there to also, weigh in on this conversation we are having.
Please follow us on our social media platforms at Official Primorg. Primorg is spelled Primorg. Remember that we are streaming live on Facebook at Official Primorg.
And remember that this program is interactive. The WhatsApp phone line to send your message is 09022656167. That is 09022656167. This number is for messages only. Please begin to send your messages now to 09022656167. I want you to weigh in and tell us if you've been paying for not for sale if you've been buying mosquito nets branded not for sale, and at what cost. Why do you think this corrupt act has been sustained in Nigeria over the years? How best can the government and its agencies combat the sale of free mosquito nets? Are you aware that mosquito nets with inscription not for sale are not supposed to be sold? Alright, and just to tell you, this is Public Conscience, a production of Progressive Impact Organization for Community Development. We are talking about illegal sale of mosquito nets, free mosquito nets on our streets. It is an interview done by Clear View TV, and I have in the studio Dr. Aminu Mahmood Omar, Assistant Director, National Malaria Elimination Program. I have Nten Eban, Script Editor, Trust TV, and Dr. Victor Otubo, Medical Practitioner and Leadership Consultant. Thank you, gentlemen, for being here. So let's get back to the issue. Let me get back to Dr. Mahmood, because earlier you were explaining the challenges you're having with the people trying to steal from.
I think Dr. Victor has highlighted exactly what we have been doing over the years. So over the years, we have to develop mechanisms to ensure that these needs are getting to the people that really need those needs. Mm-hmm. So we developed so many apps and technology that we are monitoring those needs. As they are moving from one place to another, we are monitoring those needs as they are moving. And what we normally do is we have a robust system where we have a macro plan to identify the target population that require these needs. And then when we have that macro plan, we know the number of needs that is required to cover those community or areas that we are targeting. Then we make a provision, or we procure those needs, we brought them to those areas, and then we distribute what we call a need card. A net card is a card that we distribute it to people's household, and the thing that people that will come and present for them to get the needs. So when they present that net card, that is when those people that are distributing the net will indicate that that net has been redeemed. And for us to believe that that net has been redeemed, those people have to bring those net cards that were being collected from the household. So these are some of the ways that we monitor those needs. We already have, as I mentioned, Dr. Victor has already highlighted, a robust technology that we are using to monitor these needs.
Before Dr. Victor comments, I'm just saying that according to Intent's investigation, is that in spite of all these mechanisms you have put in place, that people are manipulating the system and defrauding the system.
And imagine how close Abuja is to Nasarawa State.
So
this is from Abuja and this is Nasarawa State. Less than how many kilometers? Then what happens to states that are hundreds of kilometers away from Abuja?
I'm just curious to find out what is the program NMEP doing about the fact that people are stealing this net that are supposed to be free. Is there anything you are doing about it?
So, as I mentioned, besides that mechanism that we have, at the end of the activity also, we have a system where we go to the community to do a kind of a brief survey to understand whether those people in the community receive those needs and things like that. So that is how we put so many mechanisms to ensure that those nets are getting to the people. So what we really also in the program want to understand is how those nets are getting out of those communities and going into the market. It's something of very concern. And I would like these media companies to also take it as a challenge to go and do further investigation. If you see nets in the market, try and identify the source of those nets. We are also very interested in knowing how those things are happening, because that is only when, or some of the way that it can help our program also to develop additional mechanisms to ensure those nets are not getting out from where they are supposed to get to.
Are there plans to apprehend these culprits, because they are out there according
Honestly,
to
yes. The thing is, you need to understand that we are a regulatory agency. We don't have the capacity or the right to prosecute people. But the people in the community, if you didn't get this net, and you know that these nets are meant to you, and there's a provision for this net in your community, and you didn't get them, try and report it to the necessary authority. We have the authority that can take responsibility for that, and they can prosecute the people that are doing those things to take those nets from those communities.
Right,
and within our program, we are also doing everything to work with the security agency to ensure that whenever this kind of things happen, we take necessary action so that those things cannot happen. Anytime when we had this kind of on-call things happening, we sack a lot of workers. We have so many things to sack them to make sure that in the future we don't engage them in the subsequent activity that we are doing. These are all things that we are doing.
Do you have statistics about your disciplinary actions on those who were found wanting in this regard?
To be honest, I don't have the statistics, but to my knowledge, I know that so many things have been happening to ensure that whoever that is involved, or we hear anything like this, or we come to community and realize that those communities did not get adequate need that we are anticipating for those communities to get, we take some action. And some of those action is we sack all the health workers that are, or those, we normally, the thing is, you need to understand the kind of how we normally engage some people that are involved in this distribution of need. I think that can also help in understanding the situation. So we work with the state, as I mentioned earlier, to ensure that those needs get to where they get to. And then we also work with the local government. So from the state, the net will get to the local government. From the local government, the net will get to the community. So we normally work with people from those communities. As far as we're concerned, we want community participation and engagement in our activity, and we want people that they know the community, they know the terrain. If you bring somebody that is outside the terrain to distribute this net, this kind of things will happen more. And those people, if you bring someone that is not within the community, they don't have that will to help those people in the community. But if somebody is within their community, is involved in this thing.
I'm sure you must have gotten mosquito nets from one or two persons that is tagged not for sale. Where did you get the mosquito nets from? We really want to know. Call us and join the conversation. Let's come to Dr. Victor. Let's hear you react to things that I said here already.
Okay, thank you, Doctor, and team for the conversation again. I was expecting that maybe on this call we would have representatives from the Independent Corrupt Practices and Other Related Offences Commission, because when there are no consequences for behaviors like this, that's when people continue to carry it out. And when you sanction people at the lower levels in the corruption chain, right, you actually do not do anything, all right, because when the consequences come from the top, right, if, for example, a director who is responsible for a particular region or whatever, however the distribution system is one who is held accountable for something going wrong in the line of his own command, he's going to step up. If you have to go to the center to maybe sack one community health worker or whatever and bring someone else, you can't make an impact. All right. So it's important that the people who are held accountable for these things are people who are in the leadership and decision-making places. the moment they know that their own welfare is at stake, it will shock you how innovative they will become in implementing what needs to be done. That's very, very, very easy. Now, the thing we've discussed about that a lot of things has been done over the years. We already have so things in place. Activity is not productivity. We can be busy like doing things, but what we want to check is outcome. All right. And one of the things I want to recommend to the agency would be that the people that need this thing the most, just like we identified, are pregnant mothers and under 5 children. And once you identify pregnant mothers, you've identified under 5 children. All right. So we want to see that every antenatal clinic, part of the things that women are entitled to is every hospital, because if we engage, let me say, in a hospital, for example, where I'm the medical director, and people come here for antenatal, and I have a record of all the deliveries we've done, whether CS or normal delivery, and I have all of those data for previous maybe months, and I'm able to report this. With this estimation, the agency is able to provide us directly with materials, and I have the responsibility to report for every woman who goes for antenatal, and we book the person and we have a data, we have the report, and these reports are corresponding with the authorities or the regulatory bodies or however the chain of this thing is. This way, we are very certain that it is going exactly to the people that will have the maximum use for it. So when I see a woman in a clinic and I'm counseling the woman on the importance of sleeping under mosquito-treated net, when I'm done talking to you and I give you handover, you can't sell it, except maybe I'm not a doctor. But there's no obstetrician or gynecologist who is trained professionally and talks to you on the importance of this thing we're giving to you.
But they're not sensitized enough.
Maybe they don't have enough sensitization, or maybe that's why
I also know that Milton has been itching to say a lot of things. Please comment.
Yeah, the thing is, at the health centers, like you said, some of them have been distributed to health centers and they need to come with net cards. The health center we went to, there was none.
None. I watched the video.
Oh, you did?
Yes, I did.
As a matter of fact, we even had to give them the one we bought while trying to explain that this is what is going on.
And I was about to ask you, when last did you do the distribution?
Yes, I think the health worker there said it has been over 10 years.
And the one they had, sometimes
they have been overused.
When this thing becomes overused, it can become a focus for infection.
Yeah.
It now begins to trap and sorry, sir.
Okay.
So they are not there.
So what is happening is, these mosquito nets, we normally get them as a spot from our partners. To procure this net, to buy them into the country, it involves a lot of process. It's quite expensive and capital-intensive project. It's quite expensive to bring just a few nets into the country, and then to imagine the kind of process that involved in bringing those nets from the company where it is being produced to the show and the kind of stores that you need to store those nets. It involves a lot of process, and then when it gets to the state, how it will be taken to various locations, and the kind of people that you are going to engage, it involves a lot of resources.
Doctor, can I ask you something briefly? Okay. Sorry for cutting in. Don't we think it is very wrong at this 2024 that Nigeria cannot produce nets and we have to import it? Even with these partners we have, if they want, can't we renegotiate for the production plants to be local here
to reduce cost?
To reduce the cost. Number two, I heard you mentioned something earlier about private companies that have rights to sell nets, and I think there should be a regulation around that to completely zero it and rule it off. Why? Because that's already a lacuna for a lot of things to now go wrong. We need to know that all nets in Nigeria are not for sale, because the quantity we already have not for sale is sufficient, so we don't have to create a market for it. The moment we create a market for it, you've created room for people to even take those ones and just take scissors and cut off not for sale and repackage it. And that's already on its own completely annuls every effort that we're making as an organization to regulate and make these things to work. So two things. Can we make this production to be local? Number two, can we completely make it illegal for private or institutions or companies to produce and sell and distribute?
So for so many years, our program has been making so many efforts.
Yes, sir.
To see if this net can be produced locally. You know, to create a plant that can manufacture this net require also a lot of resources. And we are looking for partners or any private company, entity that is willing, has intention to do this. And as much as we can within our program, we will try as much as we can to support them to ensure that happens.
So I can send a proposal.
Doctor,
I want to know.
It's okay. I think the laughter is enough sign that he would accept the proposal. But Dr. Aminu, looking at the whole thing, because you sounded helpless, that you cannot apprehend those selling on the streets, and you cannot also bring to book officials who are leaking, because there must be somebody playing this drum behind. So the question is that, are we going to fold our arms and watch this go on, or will your agency, maybe push? He mentioned ICPC. What will you be doing to curb this?
Like I mentioned, we work with those agencies. If we find those kind of instances, we report it to authority. We don't, because this, remember, I can assure you that some of these needs have been given through philanthropic individuals. Individuals give money willingly to support this activity, to support this need, because we know that a lot of these people doesn't have the resources to buy this need. Net is as cheap as 5,000, 10,000. Someone, instead of him to spend that money on net, he would rather use it to buy food, because they are struggling to find something to eat. So we are also very concerned when this kind of things is reported to us, and we, as much as possible, take unnecessary approach to ensure that this does not happen. And we have been working with authority. Anytime, the thing is, as I mentioned, we work with the state government, and the state government take full ownership of most of this distribution. So we at the national, we provide the information, we provide the figure on the net required by the state.
So let him just round up, because with the information you have, you are assuring us that you are going to look into the continuous sale of this net.
Definitely, something that we will investigate further. We need to find out what is happening, and as much as possible in the program, we need to work with the authorities to see that all the culprits that are responsible for those groups are put to book, so that this cannot continue in this country. We don't want this kind of behavior to be happening, actually, and especially it's creating a bad name for organization, which we don't really like that.
All right, Clinton, did you engage with any government officials or agencies during your investigation? Because he said that Dr. Aminu said that they are handed over to the state government, or the state government rather. So what's your engagement like in the course of your investigation?
We try to get across to them, and I made calls to the PRO, that this department, say no, they are not the ones distributing now, and all of that. We call, they'll be buffed, sometimes they won't pick. Like, there's even an ongoing investigation where we're doing on the road somewhere in Nasarawa State that has been abandoned. I've called the councillor for like 10 times. As soon as he gets people to know I'm the person, he rings the first time, the next time the phone is off and all of that. So many times you're trying to meet them. They don't want to, because they know that something is going on that is not right. They don't want to answer you. So ours was just, okay, let us put this news out there. Let's see what happens after we have done this. Prime org is amplifying this. Okay, probably later on the authorities could take action. But like he sounded helpless, I don't think they are very helpless. Right now, if you go to Maraba Massacre Axis, you find them selling on the street. Okay, try to buy one. Open it. This is not for sale. All of you come here. Maybe the tax force. You're under arrest. Come and produce the people who gave you this. Where did you get your supply from? That's a starting point. If someone has been arrested, where did you get your supply? Like one of them told us that there's a warehouse somewhere. Where is the warehouse? He doesn't want. By the time you are being arrested, you will mention where the warehouse is.
So the sellers know that this is illegal.
They know.
A particular woman in India,
the lawyer said, Franciti said, it's not just the sellers, even those of us who are buying are guilty of the law.
Yes.
That I went to buy a net written and I can read not for sale. I'm also guilty of the law. So the point is, they are not helpless. Government is not helpless. They don't want to do it. If they want to tell themselves the truth. If you go to the market, arrest one person, where is this thing coming from? It will come out when the government is that powerful. After God is government. When they are ready to do something, they will do it.
Yeah, and you know, like you pointed out, my understanding now is that this problem starts the moment it leaves the federal level and hits the state level. But I think that's now where the regulatory powers of the regulatory agency now plays part. I can't send my child to school and I say, I've paid your school fees, go to school. I have to monitor your continuous assessments, your homework daily, see how you're performing and see how to get you to improve if you're not doing so well. And that's the parent role of the national body to the state levels. Because if we say we've distributed to Nasarawa 500 million pieces of nets, please, these are the guidelines to distribute it. Take, buy. We've not done anything.
So a lot more monitoring should be there.
Yeah.
Gentlemen, we have barely 1 minute or thereabout to wrap up this conversation. I'm going to come to you, Dr. Aminu, so that for your takeaway and what we are expected, what we should be expecting from NMEP after this program. So what do we expect? What will you take away from here?
To me, I think we need to re-energize our tracking mechanism to ensure these needs are getting to those people that are involved. And then secondly, I think there's need for education and awareness campaign to inform the population and community about this diversion of nets, and encourage people, if you see that kind of net outside, report it to authority and don't buy those nets. It's illegal to even buy it, as we mentioned. Why would you buy something that is not for sale? You know, it's not meant for sale. So then why would somebody go with his own money to buy things that is level not for sale? I don't think it is right, you know. So, and then there is also need a sustainable solution to address poverty, because we know that people, because of poverty, that is why they are engaging in this kind of activity. Someone, because of money and other things, the net that is given to him, you go and sell it. So I think this need to be addressed, and that is only when we can be able to see these things being prevented in this country.
Any plans to apprehend culprits? Because you must have culprits all the time. People who are stubborn and must go and do the wrong thing.
Certainly, as I told you, our partners, our funders, the government, if any person is involved in any illegal thing, we don't keep quiet. We write reports on it.
What we're saying is, like, sorry, I forgot your name. Okay. Yeah, I can just say, let's just go to Maraba this afternoon. We'll drive with the police and some of our regulatory people, and just go there. Hey, give me 2 nets. They give you. I see, I just buying it. They just arrest you, put something on your head, put you in the van, take us to where you bought this. He must take you there. Must take us to that warehouse. There's a warehouse he told us about. And we get there. And the moment, if you do this once,
the next is some of them
the moment people know that there's consequence for wrong behavior, or immediately you've raised the bar. I know the last time I was here on the program, I told you of a tweet I read from Moalo Kingsley, when he said he was in Switzerland, and just somehow he finished work just driving out. He thought maybe he was in Lagos, or maybe one of our very
because
busy.
the traffic light.
Why? The CCTV camera went off and the traffic light went off, and just somehow there was no way to track people who were driving wrongly, and everywhere went KY. So once there's no consequence for behavior, I mean, it's
So, gentlemen, this conversation will not end here, but a lot is on the shoulders of the NMEP to restore some of these ills in the society. And I must thank you so much, Dr. Aminu Mahmoud Omar from National Malaria Elimination Program. Thank you for coming, because thank you for honoring our invitation and explaining some of these things. It's been a robust discussion here, and we have to end it here. Our time is fast spent.
Okay, for you out there, please visit our news website, primorgnews.org. That is primorgnews.org for all the details of our reports and interviews. Visit our website, www.primorg.org, to get all the information about Primorg.
And you can watch our videos on Primorg TV, our YouTube channel. Please subscribe to get reminders when we have a new post. We appreciate our guests, Dr. Aminu Mahmood Omar, Assistant Director, National Malaria Elimination Program.
Thank you very much. And I want this program to, please, if you can do more on this, because we really want people to create awareness so that people should know that this is illegal and they should be buying, should stop buying those illegal nets that they're seeing in the market. Thank you.
All right. We also thank Dr. Victor Otubo, who is a medical practitioner and leadership consultant. Not forgetting script editor at Trust TV, Nteng Edman. Thank you so much for being here.
Thank you, and I'd like to thank the CEO of Clearview TV, the background upon which this report was, carried out. Samad Youngbello, thank you, and it was nice doing this.
All right, more grace to you, boss. Public Conscience has the support of the John D. and Catherine T. MacArthur Foundation, committed to building a more just, verdant, and peaceful world. Get more information about the foundation on its website, macfound.org.
Join us again here next week for another episode of Public Conscience, and remember to follow us on Facebook, X, formerly Twitter, at Official Primorg. I am Esther Bassi.
And remember that birth registration and certificates are free if your child is under 18. Help stop the corruption in birth registration, and do not pay for birth certificates. Also remember that you can give us information or hints about corrupt acts through our phone at 09022656167 or info@primorg.org. I am Chidozie Ogbonnaya. God bless Nigeria.